Hello, I'm your host, Brian Callanan. A new report shows the number of people who are living unhoused in King County is continuing to rise. But for the new leader of the county's Regional Authority on Homelessness, that's just one of many challenges ahead. The Regional Homelessness Authority's latest point-in-time count shows there are 26% more people living unhoused in King County than there were just 2 years ago.
Everybody in the community is frustrated.
That's not the news local leaders or anyone want to hear. But the KCRHA says under its current budget, it has fewer than half the shelter beds needed to accommodate the thousands who need help.
The headline here is that we've got $2019 for a 2025 problem.
Possible cuts to federal programs could also affect the KCRHA. Plus, locally, city bans on public camping are creating obstacles for the authority. And all eyes are on this fall's election to see how potential changes in city and county leadership could affect the KCRHA's future.
Homelessness is, at its core, a housing issue.
How is the new leader of the regional authority responding to a host of homelessness hurdles?
So I think we're still building trust.
It's a one-on-one with Dr. Kelly Kinnison of the KCRHA, next on City Inside Out. Welcome once again to City Inside Out here on the Seattle channel. Brian Callanan here with you, and I'm with the CEO of the King County Regional Homelessness Authority, Dr. Kelly Kinnison. Kelly, thanks a lot for being here.
Thanks, Brian. I'm happy to be here.
Let's jump into it here. You started this job back in August, less than a year ago, and the situation you came into was a bit unsettled, let me say. There was a revolving door of CEOs, as you know. The authority made a lot of homeless service providers unhappy with a series of late payments before you arrived, and KCRHA shut down a major project in 2023, Partnership for Zero, to end visible homelessness downtown. So plenty of fires to put out for sure. I just wanted to ask about this. What was it about this position that said to you, this is the job for me?
Yeah, my background is in human services and bringing systems together to meet families and individuals where they are, and really doing that with equity at top of mind and making sure that those systems have equitable outcomes for families.
You were working in D.C. before you were here, right?
Yes, I was at the U.S. Department of Health and Human Services.
Thank you. Okay.
And so getting I got the job description from a recruiter, and I thought, wow, if this couldn't be written any better for what I would like to see in my career next, bringing all that federal policy experience and getting back to the local level. Yeah. Well,
there's plenty to work with here, as you know, and I just wanted to get into it. I mentioned a few of those different challenges for KCRHA. What was the most urgent need that you saw when it comes to running this organization, and what's been your approach to that?
Oh, prioritizing the fires. Yeah. I think really two things. One is just stabilizing the organization. The staff who had hung in were really working hard to continue services, to providers. Yeah. And we had a completely empty, senior sort of leadership and executive leadership team with just a few exceptions. Mm-hmm. And so really just getting back to mission and getting everyone rowing in the same direction was critical. And then I think listening, coming in from DC, there was a lot of speculation about what I might be like as a DC bureaucrat.
Here we go. Okay.
And I told a lot of my city and municipal partners, I'm a proud bureaucrat. I'm here to run an organization that's responsible for, over $200 million of taxpayer money. And there's things you have to do when you're working with public funds. And so there's a little bit of a call to get back to basics and then just listen to the community about what they want KCRHA to be in our region.
Thank you for that. I want to talk about this recent point-in-time count. So this is the count that's required by the U.S. Department of Housing and Urban Development, HUD, to estimate how many people are experiencing homelessness in King County. You know these numbers, Kelly. They show that in 2024, there were 16,868 people who were homeless, compared to 13,368 from 2022, a 26% increase. I want to go big picture first. What do those numbers say to you?
Well, first I would set the stage by explaining that KCRHA is the emergency response system. So once someone has come into the system, found themselves unsheltered, that is where KCRHA is responsible for providing services within available resources.
I see. So maybe a city team from Seattle would bring someone, make a referral of some sort, and you would handle the case from there.
Correct. The funding that we provide to providers is intended to support shelters, rapid rehousing, day centers, and those sort of critical immediate supports while we're waiting to get someone into permanent housing.
Thank you.
Yeah. Unfortunately, we don't really have a lot of levers as KCRHA with the inflow, and we don't have a lot of levers with the outflow to housing. So we're really charged with our new mission is to reduce unsheltered homelessness using those equity and social justice principles.
Okay.
And so there's a lot of working really carefully with the communities and providers to make sure that we are utilizing those resources as best we can. And so we use that point in time count data to understand what is the inflow looking like, what is the outflow looking like. The point in time count is one night, a snapshot, and it's nationally considered an undercount.
Yes.
But it gives us some sense of how we need to think about how far our resources can go.
When you look at that increase, though, what was your reaction to that?
It's really heartbreaking, and it's a reflection of our policy choices. We can look at spending on criminal justice, on lots of other things, and we have to make choices. I'm not the person who makes that choice. Of course, I advocate for homelessness services, but we need more funds in the system, and we need to ensure that the funds we have are being used in the most effective way possible, and that requires us to be really nimble. It also requires addressing the huge disparity in the homelessness data. As I'm sure you saw,
right.
There are some groups, including Indigenous peoples, people of color, who are dramatically overrepresented in the system, and that really speaks to some changes that need to be made.
Thank you. And I'm definitely going to talk about funding with you in a minute, but I did want to dig a little deeper on these numbers here. I was struck by those disparities in the racial disparities you were talking about there, and then also a disparity in the amount of resources available, like shelter beds. Looking in North King County, for example, the amount of shelter beds is so low, you have nearly 10 people who are unsheltered for every available bed. Compare that out to the Snoqualmie Valley area, where there are 1.5 people who are unsheltered for every available bed. So overall, as I saw it, King County has fewer than half the beds needed to try to accommodate everyone who needs shelter. I did want to ask you about that too. What do those numbers say to you?
It says to me that we really need to move into system thinking as we make budget decisions, as we decide where new shelter goes, where services are deployed. Historically, we've had a very sort of programmatic view. So, do programs work?
I see.
Who's
Okay.
getting funding? How
Looking
many
more
do we have?
system-wide then. Okay.
Right. We need to come up a level, and this is what the community has been sharing with me with great gusto. We need to make sure these are all working together, and we're not overlapping, duplicating services. We're supporting providers and their workforce, and really getting resources where they need to be.
Got it. And you're going down a path I would like to keep going with you here, because KCRHA has relaunched its system performance dashboard to give the public a better look at how the KCRHA's programs are performing overall. I don't know how to break apart these numbers, but I did see overall, when I look at that first part of the website, 60% of your programs are helping people to be permanently housed. That sounds great. Of course, I'm worried about the other 40%. I know you are too. How do you interpret those numbers, if you could answer me that? And why was it important to you to relaunch this public-facing dashboard?
Data is really at the center of how KCRHA, is moving forward, so that we are using data-informed decision-making, using data on inequities and system performance to make sure we are not just talking about equity, but moving in the direction of changing the system. The other thing that's been made really clear to me recently by my research and data team is, a lot of smaller continuums of care, which are the organizing body for a lot of homelessness services across the country, rely on data that HUD posts. And with changes to administrations, taking down information, it's really important to a region like King County that we have our own system dashboard that folks can go and use it and pull numbers and understand what homelessness is looking like today. We'd like to get to monthly updates of those and really focused on making them as usable as possible.
And I do want to talk about that federal funding piece and what's happening there, because I saw a report recently in the Seattle Times that shows King County is preemptively suing the Trump administration along with some other jurisdictions over potential cuts in homeless grants. If you could focus on the federal side of this first, what's going on, Kelly?
Yeah, we have about $23 million that typically comes to KCRHA from HUD that supports our Continuum of Care work, which is a collection of projects that go through an application process and get awarded by HUD. We administer many of those. King County administers all of the permanent supportive housing.
I see, okay.
So it's about a $60 million investment in permanent supportive housing, $23 million in King County funds, and then there's a couple of sort of legacy projects that have been funded for decades.
Okay.
So the concern that we have is the contract language asks us to do additional sort of verification and other kinds of attestations that we will not support things like gender ideology is
Right.
the language that
This whole uproar over DEI that the Trump administration's been talking about.
Yes, and I think specifically targeting trans individuals and sort of how we talk about, gender identity, sexual orientation, and those things in our programs to make them more inclusive, more welcoming. It's really important that people know that they are safe when they're getting services, and so it's a real concern that programs might be asked not to speak to folks who, really need to know that they're safe when they're in human services programs. Yeah. The other thing is around immigration status. So using a system that is, to the best of our knowledge, not really functioning right now to verify immigration status and eligibility for programs. And we just have really, deep concerns about using those kinds of levers to impede emergency services to anyone.
Right. And I hate to ask this question, but what happens if those cuts actually went through?
It's a real scenario that we're talking about with our partners, our funders, providers. We are going to do our best to make the decisions that have the least, do the least damage to the community. I think, there are ways that we can work around some of the problematic pieces. But in the end, if that money goes away this year or next year, it's going to leave a really big hole in our system.
Let me move it down a level, if I could, talk about the state and local level, because you've got the State Department of Commerce making up 10% of your budget, King County 26%, City of Seattle 53%. All those local governments are going through their own serious budget upheavals. Are there concerns about that state and local funding piece? What can you tell me about that?
Yes, I mean, as of the end of the session, things are looking better than we had initially started.
State legislative session.
Yeah. Yes, thank you. Started preparing for, but we also know, as you said, the local budgets are really tight. The forecasts are not looking good.
Pessimistic is the word I hear from Seattle quite a bit. Yeah.
Yes, that's right. And so we're in conversation with folks about the choices that they're going to need to make. Of course, advocating at this point, I think this year, next year, it's really about keeping existing resources online and really supporting that sort of facility-based services. So our shelters, our day centers, places where people know they can come. We don't want to see losses in the system. And I think if we can kind of mitigate losses, that's really our win for this year and next year in terms of, impacts.
I need to ask this one too. County Council Member Teresa Mosqueda brought up at a meeting in April. Maybe KCRHA needs to have its own taxing authority. I know that's a bit of a reach here. Is that something that you would support or think about, or what do you got?
Yeah, I'd love to work with the King County Council and anyone else who has ideas.
They would have to make the call on something like
Absolutely.
that.
I know that was contemplated as the agency was being formed.
Yes.
Of course, I wasn't here then.
Yes, right.
But would love to dig back into that. You know, we're in a very different environment now than we were in 2018, 2019 when those
Right.
conversations were happening.
Yeah.
And so I think it's worth a look always. Are we doing this the best way possible? Do we need to iterate?
All right, thank you very much for that. I did want to talk about this idea of trying to involve more cities in supporting the KCRHA, because King County and Seattle make up more than 3/4 of your budget. I just mentioned that. The interlocal agreement with smaller cities in North King County makes up only 1%. I just have to ask it, if the idea is to approach this issue regionally, which I know is very important here, do you think you need more cities to put more skin in the game? How do you approach that?
Yeah, we're having a really robust conversation with the board and with our partners about regionalism. What does that mean in a region like, you know, King County, where you've got really different contexts where the issue is playing out? And Brian, my take is that regionalism doesn't mean one size fits all. It doesn't necessarily mean we need uniform policies that everyone needs to adopt. I think we need to think of it as a cohesive system. I think we need to think of it as that investment doesn't necessarily mean dollars. Investment can mean coming to the table, sharing. There's a lot of great things going on in our region. Sharing those lessons.
Programs that are working, et cetera.
Exactly, yeah. And a lot of that, just there hasn't been a body that has been able to facilitate that learning. And I think, you know, my philosophy is attraction rather than promotion. So if we become an organization that has value to offer, then cities will say, yeah, I'd rather not administer my own severe weather funding procurement. KCRHA has been doing this, like, let's partner and really make sure that service providers and county officials and city officials across the region are spending their time on what they uniquely do best.
A thorny question for you here. When you see cities like Burien or Auburn passing bans on camping, which I know can have a major impact on people sleeping without shelter, how do you respond to that? Are you able to talk with those cities? What's going on with that whole camping ban issue?
Yeah, so I think we're still building trust as a new KCRHA that is a public organization that brings research and data to these questions and then talks about likely impacts, has analysis, and will work with everyone who is interested in working on this issue. We are not an advocacy organization. We, I think, are here to partner with folks, meet communities where they are. This is a community issue, and I really believe that community voices of all kinds need to inform the solutions in those communities. And so, yeah, I will work with anyone. I think we can.
You're talking with these different cities.
Absolutely. Yeah. Yes. The mayor of Auburn, Nancy Backus, has become a good mentor of mine and is on our governing board. So know a lot about what's happening in Auburn, and they've got a solution right now that they feel is working for their community. I think that's really important, and it's important that we have data and think about, is this working? Who is it impacting? Are there disparities emerging? We can address those, right? We just have to be really open about how is this working? What's going next?
Thank you. Another city question here, and this is a tough one too. The number of homeless encampment sweeps has steadily risen under the Harrell administration here in Seattle. Seattle Times reporting on this. In the past 2 years, the city has taken down more than 8,000 tents, breaking all previous records in recent history here. Do you believe these sweeps are effective? How is this impacting your work? I wanted to ask that too.
Yeah, I mean, my sense is that the mayor and the Unified Care team have been really clear about what they are there to do and what they can and cannot accomplish. They are there to enhance public safety. They're there to ensure that public space is usable by everyone in the community. And I think that creates a real tension because our unhoused neighbors are part of the community as well. And there are certainly areas, blocks, where those communities, those neighbors, those citizens are bearing the brunt of encampments, tents, and some of the things that, folks prey on those who are unhoused. We see more drug activity sometimes. And so I think it's important that city leaders can make those decisions and use available data and resources about best practices.
Yeah.
We know a lot about what moving people around does.
Yeah.
And there are ways.
Is it hurting your work, or how do you look at that?
No, I think of it as synergistic. I mean, we don't have outreach contracts for the city.
That's right.
Those went back before.
Yeah,
that
those are
decision
city
was made.
controlled.
Yes,
That's right.
That's right. So it's important to us then to help. The handoff point is at when folks are referred to the shelter. So how do we continue to work together to make sure that we're not letting anyone fall between the cracks, if at all possible?
Thanks. I did want to talk about something that's been going on over the last several years. Local elected leaders really pushing the KCRHA to ask for rebids on the contracts you have with service providers. I know there's a big concern over funding. Is it time for these rebids to happen? What's your message to service providers who work with the KCRHA?
My message is we've got a lot of, I think, what feels like shakeups happening in our system, and KCRHA does not want to contribute to any sort of feeling of additional instability, additional risk to clients. What rebid is to me, we call it not rebid internally because we don't have a better name for
Okay,
it.
all right. We're working on it.
But
Okay.
not rebid
Yeah.
is really about a mutual accountability in the contracting process. So KCRHA has not had a lot of what we need to effectively administer contracts, and we're working. That's been my focus in the past 9 months. We've done a lot. We've launched a new grant management system, really increased service for providers. And then we can be clearer about what we need to have from providers to assess performance and really build that system out. And it's just normal in a contracting environment that every few years you do a new request for proposals and you evaluate the contract performance. And so I see it as more getting to like best practice good government business and less as like a big shakeup, which I think is sort of how it has been framed in the past.
Thank you for answering that. I did want to talk about when the KCRHA was formed in 2019, there was a real focus on including a lot of people with a lived experience of homelessness in terms of its governance. Last fall, KCRHA changed its governance structure, getting rid of the implementation board and just going with a governance board made up of mainly elected leaders from around the region. Talk to me about this change, and are you concerned that KCRHA's board has fewer people with lived experience now?
My goal is to have people with lived experience involved in all of our work. I think it's great that we have the 3 wonderful experts with lived experience on our board. I think the board is incorporating those experts in a different way as well, which we'll see if that is adding to what they are able to bring and share with me as the CEO and our agency in terms of policy setting and direction. I really admire the board for iterating until it makes sense and until it's working. That's how I lead the agency. We have a Continuum of Care board that oversees all of our work that's HUD funded. That is made up of a large number of folks with lived experience as well as other experts. They are an advisory board to the governing board. And so I think what the Continuum of Care board and I would like to see is just a more synergistic relationship between our board governing KCRHA, the board that governs the HUD work, and then our community outreach. A number of KCRHA staff, my guess is around 40%, also have lived experience. So it's really a field where folks want to get involved, want to change the system once they've had system involvement. They have so much to bring, and we would be, kind of crazy not to make sure their seat at the table is centered.
Thank you. I wanted to talk about a existential issue with you, if I could, with regard to ending homelessness. There have been committees to end homelessness in King County. The city and the county had an emergency declared when it came to homelessness a few years ago. Do you believe it's possible to end homelessness?
Absolutely. Yeah, it takes a lot of folks. I think, at least once a day I read that KCRHA is the entity responsible for ending homelessness, and I think, oh wow,
oh boy. Okay.
that would be a really big thing for one agency to do, right?
Okay.
Many agencies, communities, funders are involved. And it's about policy choices. I mean, we have decades and decades of research on what works. We do need to tailor that to individual communities, to our funding environment, but we need to come together as a system and sort of stay the course to really see those impacts.
Thank you. I did want to start wrapping up with you here if I could, because it seems like the role of the KCRHA has changed over the past few years. It was a little bit more of an aspirational voice, I think, on homelessness issues when it started in 2019, and now it's more of this agency that's making sure the dollars are flowing and the network is working with funders and providers here. What sort of future do you see for this agency, especially in light of the fact that we will have a new county executive this fall, possibly a new mayor of Seattle by the time this fall rolls around? Some thoughts there to wrap up.
Yeah, I mean, I think it was really forward-looking to try to establish an entity that transcends administrations. As a federal employee, I worked for 4 different administrations, and so I know exactly what that takes. And it takes a transparent decision-making process. It takes relying on research and data to make policy recommendations. And then understanding that policy decisions involve a lot more than just research and data. They involve communities and policymakers who are elected. And so I see KCRHA's role long-term as being that place where you can come for the data, for recommendations, for analysis, bringing people together, administering that system so that we all know what's happening, and we can be transparent with our communities, our taxpayers. But that as we change elected leaders, we're ready to step up, work with them for their vision, for their communities.
All right, thank you very much for that, and we will be right back.
What are people saying on social media about our response to homelessness? One person writes, "Everywhere in North America, there are already enough houses to house everybody. The only reason people are homeless is because the empty houses haven't been taken from the greedy rich." Another person comments, "Eliminate all federal funding for homelessness. The only investment should be in correctional facilities with treatment programs."
We'd like to know what you think. Send us an email at contact@seattlechannel.org or find us on social media. Very good to have that input, and great to visit with you, Dr. Kelly Kinnison, CEO of the King County Regional Homelessness Authority. Really, thank you for being here.
Thank you, Brian.
And we will see you next time on City Inside Out.